Good morning. My name is Dr. Arunashri. I'm a rheumatology consultant at Continental Hospital. Today I'm going to talk about pain and numbness in the hands. What could be the possible reasons and how you can help yourself. Pain in the hands is a very common symptom and it can have lots of reasons. Pain is a common symptom which can happen when you have overused the hands. Okay? What is more important is whether this pain is associated with any swelling in the joints or if there is any numbness in the hands, if you have any burning sensation or if you feel that the sensation of pins and needles in the hands, that is significant. If there is any swelling in the hands, then obviously we need to think and see the doctor to see whether there is any evidence of any arthritis in the hands which is causing the pain. Sometimes there can be pain and numbness in the hands when we have vitamin D deficiencies like vitamin B12 deficiency. Sometimes these symptoms can be seen in other conditions like carpal tunnel syndrome, where the nerve gets pressed around the wrist area, which can be treated very easily, but it is pretty important to identify whether that is the reason for the symptoms. Sometimes people, when they are exposed to very cold weather or when they use very cold water, also can experience numbness and pain in their hands. Other reasons which can cause pain and numbness in the hands include if you're using vibrating tools like carpenters and other people. When they use these vibrating tools for a very long time, they can have these symptoms in their hands. Some patients with long-standing diabetes with involvement of the peripheral nerves can also have these symptoms, and we call it as peripheral neuropathy. Some patients notice that they have numbness in their hands only at night. That could be probably because the nerve at the wrist is getting compressed because of the posture. They might be putting their hand under their head or something like that, which can compress the nerve, and then it can cause numbness in the fingers. So these are the common causes which can cause pain and numbness in the hands. Usually if it is nerve compression, usually it is relieved by just shaking your hands. If it is not getting better by shaking your hands, then you need to see whether any of the above reasons are causing the symptoms, for which you need to see a doctor and let them examine you and assess properly to identify the underlying reason. If it is because of vitamin B12 deficiency, then supplementing the vitamin B12 tablets or injections can relieve the symptoms. If it is because of either thyroid problems or uncontrolled diabetes, then controlling the underlying disease itself can relieve your symptoms. If the doctor feels that your symptoms are because you have a swelling in the joints or something like rheumatoid arthritis, then you need to see the specialist and get treated. If the symptom doesn't get better with the symptomatic treatment and vitamin B12 supplements, then obviously we need further testing and identifying the underlying problem and treating it appropriately.